Hi, this is Dr. Thomas Giancarlo. Neurology is a subspecialty of medicine. It involves diseases of the central nervous system, which is brain and spinal cord, peripheral nervous systems, which are the nerves that exit the skull and the spine, and send signals back to the brain and spinal cord of pain, and then general pain management. We have invited several of our colleagues that have taken subspecialty interest in the field of neurology. Neurology is a field that's exploded in the last 20 years because so many developments have evolved with regard to understanding different disease states, and with that understanding, interventions that were never possible when I was back in school are now readily available. For instance, multiple sclerosis is a landmark disorder. When I graduated, there were no treatments for it, and now there's 25 different treatments, essentially, that offer controlling the disease, slowing it down, stopping activity. It's true, we still don't have a cure. However, I wanted to at least introduce the topics we have. My topic will be epilepsy. So we're going to start with the brain. The brain disorders that you'll hear about are headaches, stroke, sleep disorders. The sleep is controlled by the brain. Psychiatric disorders or behavioral disorders, or disorders that are comorbid to neurologic diseases. It's very common for patients who have sleep apnea to have mood disorders and attention deficits because of the chronic fatigue the brain experiences. It's very common for patients who have disorders of headache or other pain to have depression and anxiety superimposed. Patients who've had trauma have post-traumatic stress syndrome. So there's a lot of different overlapping conditions. Neurologists are certified by the same board that qualifies neurologists and psychiatrists to practice. So there's quite an overlap between the mind and the brain. Movement disorders are controlled by the brain, because if you look at my hand, it looks like it's not shaking. It's because the bit of brain that pulls it this way is completely balanced by the bit of brain that pulls it in extension. When the brain is hitting a bullseye, dead on target, gets it right, it looks like nothing's going on. As soon as the brain is having trouble finding that sweet spot, you see the manifestation of the tremor. Or it could be an imbalanced movement where it pulls one way or the other in an abnormal position. And that's called dystonia. And diseases like Parkinson's result in that, as well as cervical dystonia, where it's the head that tilts. And then dementia. It's an increasing disorder that an aging population experiences, and we're now coming to the age where there are some interventions. They're still by IV infusions that decrease the amount of amyloid burden, which is an abnormal protein that accumulates in nerve cells and causes them to start being dysfunctional and eventually dying, and that results in the dementia, or the loss of cognition or memory or learning or math or reading or visual function. Those are disorders of the brain. Multiple sclerosis is an overlap. 90% of your myelin is in your head. Multiple sclerosis is an inflammatory disease of myelin. 90% of it is in your head. The other is in the spinal cord. So it's a good disease to transition from brain to cord. And then the rest of the cord runs in the spine. There's several nerve roots in the cervical spine, the neck, and then in the lumbar spine, the back, that to run out from those areas through tight anatomic spaces that can be impinged upon by disease, by tumors, by bony spurs, by disc bulging, by thickened ligaments, etc., that then cause entrapment syndromes. When it's entrapment of the root, it's called a radiculopathy. When it's entrapment of a peripheral nerve, like in this area here, it's the carpal tunnel. And then there are generalized nerve disorders where the nerves have metabolic or toxic effects by other disorders that eventually start causing the nerve to pull back or shrink. It's called fiber length dependent polyneuropathy, where you end up with numbness in the feet, and then if it gets bad enough, the hands. And so it's described as a stocking glove distribution, sensory loss, and sometimes when a nerve fiber that's responsible for sensation is disturbed enough, it sends abnormal signals that aren't in fact happening. So you get burning, lightning, ants crawling, dysesthesias is the term, pins and needles. Then eventually, if it gets worse and it can't be fixed, you end up with numbness. So that's a polyneuropathy. And then a lot of pain disorders emanate from the spine. Pain management is regarding pain disorders of the spine or the major joints. And at Michigan Neurology, we handle all of those kinds of disorders. So I welcome you to listen. We have associates in these various subspecialty. It's becoming more and more popular that as medical field enlarges with regard to its knowledge base and therapeutic options, that doctors both subspecialize, and in our case, we have physician assistants who've subspecialized as well. I myself am board certified in general neurology, and then in neurophysiology, which is the electrodiagnosis of different diseases, and also in neuroimaging and pain management. So there are subspecialties that are well recognized, both at the doctors and now more so at the physician assistant levels.